Good morning, guys. Usually, we made lot many videos on repair hair transplants, spoiled hair transplants. But this week, I had a kind of a weird experience. I can say weird experience because within last 3 days, it happened to see four repair hair transplants in my consultation, and one we repaired it today. And usually we see weekly ones or monthly 4 5 cases like that, but this week they brought to my notice. I have seen in my consultations there are four patients who had done transplant elsewhere. That transplant, the placement of the hairline was totally wrong. That was almost on the forehead. That's the kind of experience I had this week. I thought to make. I have decided to make a video on airline because I already made a few videos on this. But again, I just wanted to make more videos on kind of educating the hairline placement, because these four patients, believe me, it's kind of unfortunate. I felt so sad for them because they met me earlier, 6 months before, a few guys, 1.5 year, a few guys. But unfortunately, they couldn't make it to the surgery here. But they came back to me with the trust and because the lenience and freedom I gave to them to get any complaints to me. Then it happened to see them yesterday, day before yesterday, today also I did repair one case. Total four patients actually. Their hairline is totally spoiled because someone has placed fine far front on the forehead. They made a transplant that looking really weird. So today we are going to discuss about one case, such case repaired today, and this is very important video for youngsters to understand why one should not choose this kind of hairline design. So kindly watch the video to understand our consultations experience as well as the today's repair experience of such bad hair transplant. Since last week in my consultations, I have seen four patients. All four patients came to me with kindly repair my transplant surgery, sir, because they already met me a couple of months back, a few guys, and 1.5 year back, a few more guys. So it's unfortunate to see them this situation today because I'm sure we'd be giving information to many patients every day. Doesn't mean that everyone would come for the and make it to the surgery with us, but still we are okay to help them. What are the manner they get it, because either they do surgery with us or not doesn't matter. But still giving the information, always we do give transparent information to everyone. But fortunately, unfortunately, these four guys did somewhere else, and they came back to me. And kindly believe me, someone is coming back to us to show their bad results. It's that much freedom we have given to them and that much transparency we have given to them that made them to come back to me to show their bad results, and they're seeking for the help. Kindly repair it. And that's the reason that's motivated me to make this video. Here, basically, these four guys met me earlier. We have given all the information about the transplantation. A few guys, I shared the plan what I'm going to do. I marked and shown them. Few guys were unhappy about that hairline. They went for different clinic and got it done. One thing. Few more guys, probably their maybe budget concern, whatever it is. So then they came back and asked me, doctor, what are the markings you have done? That was really good, but I'm sorry. So that we did elsewhere because we wanted this way. No one explained me about these consequences. Now what to do? So this was the situation. I met these patients last week. Out of these four patients, one patient we took it for the repair surgery today. Kindly remember, when someone says that my hair transplant is spoiled, that's okay. That gives a lot of meaning to you. But when someone say my hairline is totally wrong because someone has made almost, the patient themselves are telling me my hairline is not good. An expert, I can tell many things, but the patient's common man is telling, their relatives are telling, what is this? The hair transplant looks like a bush and kind of a awkward appearance. They're not able to go to even their functions, whatever it is. Now, what does it mean that someone has spoiled the hairline? One should understand. Don't think only that hairline has been spoiled. Kindly remember this. Someone is doing a transplant on you who doesn't know ABCD of transplantation techniques. That's as simple as that. That means someone is not knowing where to implant, where to mark the hairline. How could you expect these guys would do transplant on you? That's the main question arises here. That means, having said that, not only hairline and not only technique, what kind of safety protocols are they using for your surgery? That also important. And what about your donor backside? So it doesn't mean only your transplant airline is spoiled. It means also that your donor has been spoiled. Someone is operating on you who doesn't know ABCD of this cosmetic surgery, and someone is operating on you with what kind of safety controls, safety protocols. So these are all the things you have to understand when thinking about someone has come with a spoiled hairline. That means this was depth. It's not only just hairline. So kindly remember this point. Someone who doesn't know how to draw a hairline, what kind of execution they would do on you. That's important. So doing surgery is totally different. Doing marking is totally different. We feel every day difficult in difficult situations with different patients because each patient dimensions, head dimensions are totally different. We're going to cater according to their needs, according to their facial profiles. We're going to design the hairline. So same way we need to execute on the surgical table. So this much levels and steps of execution of surgery is there, which includes lot many staff and expertise surgeons. Then only they can do the good surgery. So these patients actually came to me. One was ready to get it repaired today. Kindly remember, usually all these patients who comes for the repair, they may need a couple of sessions to get it repaired. You believe me, repairing transplant is really most difficult task for any surgeon. No one would prefer to do it because rather I would do good cases 2 or 3. Repairing one case takes a lot of time, a lot of stress on surgeons, a lot of stress on even patient. They would need to come multiple sessions also, once, twice, thrice. So if that happens, you are losing almost 4 times extra money to make your transplantation look better. That's the most important point one has to understand before choosing the clinics.
See, this is one of the complication if you get the hairline down and this hairline looks so horrible. Patient is so much depressed and came to us to get it repaired because this hairline is not natural. This will happen because of 2 things. Number one is a budget transplant. Number two is kind of technicians, amateurs or undergraduates are operating on a cosmetic surgery would lead to this kind of horrible hairline. I'm sure how much this person is undergoing trauma after this surgery. He approached us with hope for get it repaired. We are going to start repairing today. We are going to remove all these grafts. I'm sure this man is shaving this frontal area, like kind of a temple design. Someone has made it. This is one of the horrible design. Now he's been shaving this. If you can see this bunch of tuft, he's going to shave every day. However, we are removing this as well and even this hairline also, almost this area also. This area angulations are very horrible. And if you can see, forehead is very smaller. They did not even consider these kind of points. So kindly do not think about getting your budget transplants and amateur doctors. Doing cosmetic surgery should be done by an excellent expert who has a surgical background and as well as the best skillful hands. Kindly beware of this kind of transplant, guys. This is one of the live example for a budget transplant.
On a general note, what are the consequences of such placement of the hairline? Means not only hairlines spoiled, your donor also has been spoiled. Your safety protocols must have gone to a toss, and your donor as well as the your kind of money also. Well, this patient not only hairline damaged. If you see the donor area is totally damaged for just for 2,000 grafts. This patient had only 2,000 grafts from a different clinic. Kindly remember, the damage happened backside looks like more than 6,000 grafts. That means the risk of someone who doesn't able to draw a kind of hairline properly in the front side, how do you expect that they would do good harvestation for you? They damage a lot. For 2,000 grafts to harvest that much backside, if you can see, the damage happened a lot more than that. So these are the things that you should really think about. These are the consequences of the kind of a repair transplant one should understand. Then, how do we handle it? When it comes to handling, kind of repairing, we have to plan. These kind of patients has to shell out money for twice or thrice because with one session we cannot repair it. The reason is when you are trying to harvest the grafts in the virgin scalp, we can happily harvest the graft. When it comes to the repair transplant, the kind of fibrosis that happens after the transplantation, it's very difficult for us to extract or remove the grafts. Most of the repair cases, we need to repair the transplantation, we need to remove the grafts. Removal is not that simple as with a new case because A removal will be very tough. You may need to come for a couple of sessions, usually 2 or even 3. Then you need to spend money each and every time. And surgeons will not show any interest to you because this rather they would operate on a fresh new cases rather operating your case, because you'll be expecting more outcome, more density this time, and you will be already burnt your fingers with transplantation by spending spending your money. So these are the reasons we have during the repair. These are the challenges we have during the repair transplantation. So, but how do we handle it? We need to repair these cases in a multiple phases. Today, this patient, we did a removal. I just wanted to show you what kind of repair transplant plan for him. Actually, we thought of repairing this patient. Patient had a little motivation to get it repaired. One session today, we removed all the unwanted grafts, almost a centimeter from this hairline area. And there is a limitations for us. We cannot remove all the grafts because it's very difficult. You're going to make more damage to the frontal area. We can only remove only 80% of the grafts and reimplant in the other areas. This is one aspect. Second thing is the markings, whatever that happened or created during this removal of the grafts would last for 3 to 4 months. Then only it will become normal. Until then, the small dark marks will be there that you need to bear with. And he has to come back after 6 months for further correction. Luckily, it may happen in 1 or 2 sessions. There are at times it may need one more session extra, 3 more sessions. Or the worst scenario, a few cases, it is impossible to repair. So I have seen such kind of patients also. So these are the important points to be noted before planning for these kind of transplants. And here, usually, this kind of wrong placement of the hairline can happen because of 2 reasons. Probably technicians are operating on you, probably some guys are operating who doesn't know ABCD of this cosmetic surgery principles and protocols, or some patients would request always, I wanted this kind of hairline, kindly do it. They may insist also. This mistake can happen either of the side. So if you are a good person and choosing for a good transplantation, definitely go with an expert's opinion about your hairline design or hair transplant case. Then only you can expect best outcome. Well, conclusion of this kind of patients, conclusion of this video is, if you come with kind of a spoiled hairline, kindly remember your hairline, not only hairline spoiled in your case, I'm sure your donor must have spoiled, and your safety protocols and things during your surgery must have gone to a task, because no one knows what kind of safety and guarantees you. That could lead to a lot of infections and even life-threatening complications also. So here basically we're looking at the hairline, that is the index of the transplantation. That means if someone looks at the hairline, we can guess what kind of quality work they would do. It's kind of an index. If you see the hairline, you can guess what kind of transplantation quality they have been doing it for you. This is very important to understand in hair transplant clinics. Kindly make your good research. Research in the sense that once you talk to these people, actually, unfortunately, gave me feedback saying that, Doctor, you have given all the information, but somehow we are confused that we did not take a good decision because they don't know. I'm sure I'm not blaming them and I'm not blaming anyone. Here, the point is, probably this happened because they did not agree with the plan, with expert surgeons, the drawing, what are the hairline plan and all. Probably one thing. A second thing would be kind of a low budget transplant clinics would have offered them a luring package to get it on their transplant, or could be they were confused to choose which clinic, whatever it is. The final thing is, kindly talk to your surgeon, expertise, then take decision. Discuss with openly what are the points you have in your mind that I want this kind of hairline. What are the complications would I expect if I go with this kind of hairline? Surgeon would definitely tell you what kind of consequences would happen in your case. No one would simply accept, please come here, we'll do the transplant. That kind of clinics you have to choose it. If you're not talking to a person who's operating on you, probably you will not get good information on your transplantation details. So kindly talk to your expert before planning your transplantation. Ask her all the questions and doubts clear before getting your transplant. Then would definitely get you good transplant, at least not the worst transplant. That's the conclusion of this video. Thanks for watching this video.